I want to start by saying there's pretty much nothing monolithic about the black experience. However, almost every black person I know, everyone I consider a friend, a family member, has had their parent have the talk with them. What to do when you get pulled over to not be profiled. Where to keep your hands. Don't make any sudden movements. Ask and over-communicate when you reach for the glove box or to take off your seatbelt. Hands at 10 and 2 at all other times. Yes, sir. No, sir. Yes, ma'am. No, ma'am. Even if there's an injustice against you, let mom and dad, let a loved one handle that. You know, the goal is to get home alive. The goal is to get home safely. I'm going to ask you to walk in a different pair of shoes, those of black people profiled in another aspect of life, another aspect that could too mean the difference between life and death. So what about somebody watching who may say to themselves, I don't see color, it's the human race, so when I'm dealing with these patients, it's the same thing. How dare you? What would you tell those people?
There's actually very hard concrete evidence that says differently.
So I am a cancer survivor. Be 2 years in June. When I first started talking to my doctor at the time, about years ago, when I said that I was having problems with my menstrual cycle, he told me it was because I was fat. He said, you just need to lose weight. That's it.
As a first-generation free Kenyan, those disparities were shockingly apparent to me when I moved to this country, and I said, oh my goodness, in the land of the free, in the home of the brave.
We should not get to a point where I rather choose losing my life than to deal with a doctor.
How important is empathy in all this? What role does that play?
Gosh, what if you really could feel what one person or a community that has felt neglected for centuries? What if you really felt that?
Building trust a lot of times when you first meet someone allows for better outcomes.
The same way that we have to present ourselves a certain way in encounters with law enforcement, right? The same way we have to be on guard for how we look and how we manage ourselves when we're walking through a store, because someone may stereotype us as possibly, shoplifting, right? So all of those ways, right, that black folks have to negotiate, right, with how they are being perceived, right? It's an all-encompassing thing in our everyday lived experience. It should not be that way in the doctor's office as well.
So these are just some of the people you will hear from over the next couple of days. The next 3 days, we're going to actually explore the issue of inequity in care, how certain people are treated differently in medical settings as well.
It can have some dire, sometimes even deadly consequences. Kevin's talked to so many folks, and you'll hear from them. Patients who have experienced it, doctors who have witnessed it, and the people who are gathering all of these stories for something called the Repair Project.
Pretty cool effort here. The goal is to preserve history and change the future so everyone can access quality health care no matter who they are. This Repair Project has only been in place in a few places across the country, and it's coming here to our area. So hopefully it can change our perspective and the biases that we have.
Hopefully make some change for the better, too.
Indeed.